an episode here where we talked about this, and that should give you a good insight as to everything you'd need to know about the whatever.
Okay.
So today, anyway, welcome to the Health Hour, Ian.
Thank you, Harry.
Well, we spoke about doing this for ages anyway, and we originally planned to do it right after your surgery. And for whatever reason, maybe I didn't have the gear at the time. I remember you talking how that you wanted to give as much insight as you could, and it would have been better back then because you would have remembered everything, and it would be a bit crisper or more relevant to you at the time. But here we are, many years later, finally chatting about your knee, Dad. So, wanted to just find out from yourself, or if you can give a little bit of a background for, I guess, your knee, how it came to be that you ended up getting a knee replacement, and if you want to just give some general context as to Ian Lowther, your knowledge and your education as well.
Okay, I'm Ian Lowther and I'm a sports physiotherapist and podiatrist. And when I was a young bloke, played a bit of footy, and back in the early 20s, I injured the knee and damaged the medial ligament and meniscus. And then years later, while I was working in private practice, my knee started to ache and started to stiffen up and tighten up. And ultimately, I went and saw a surgeon about it who said, we should just fix that medial meniscus up and remove it. So the inside of the knee was the sore area. So I went and had the surgery, and what I didn't know was that he decided to take out the outside meniscus as well, the lateral one. So I woke up and I had no menisci in the knee. And initially it was terrific because it stopped all the aches and pains and it felt fine. And to be fair, he did suggest to me that I shouldn't run or anything, but I was still young enough to do that and enjoy it. So I sort of went back to life normal, and just because there was no buffer between the femur and the tibia, I just wore it out fast and got to the point where it really started to get sore. I bowed, my leg was bowing out. It's like I'd been born on a broad-backed horse. And it was affecting my back and various other bits and pieces. And then I did the Kokoda Trail with my brothers one time and took that much anti-inflammatories just to get through that trek. I thought, this is crazy. And then rested it for another couple of years or so before I finally made the decision to get it done after having done the Cape to Cape. And I just, the Cape to Cape was just so sore. So I thought, I'm sick of this. Went and saw a surgeon. Surgeon said, just let me know when you want me to do it. And I sort of thought that the best thing I could do to prepare myself would be to try and get as much strength around the joint as I could before the surgery. So I spent about 3 months in the gym just doing every exercise I could, thinking it doesn't really matter what I do because the joint's damaged anyway, so I can't make it worse. And if I can build up some of the muscular strength around the joint, it'll be easier to recover after the surgery. Had the surgery, successful, spent about 3 days in hospital, and you get your normal pain relievers and you get a bit of physio and a bit of exercise and so on and so forth. And then when you leave, they give you the list of medicines that you need to take. But I have to say that you do need to be, adamant that they give you a written release, if you like, from hospital to know exactly how much of these meds you need to take for what period of time. Because, you're a little bit dopey from the surgery and, it's only 2 or 3 days since the anaesthetic.
Yeah, hard to recall everything. Yeah.
It is. So I got home and I had the list of exercises and the medications and so on and so forth and a game ready, which I thought was just the best thing ever.
I might just pause and get back to this post, after the surgery. But just wanted to hear a little bit more about prior to the surgery. You've had this ongoing knee discomfort for years. Why did it take you so long to finally try and do something about it?
Well, there's a couple of reasons. One is because, as a physio and probably general members of the public, we're always encouraged to try and, either keep all our bits or avoid surgery at all cost. So that was probably one reason. The second reason was because I thought if I can get through without having to have surgery, then that was a preference that I had. I'd rather not have the operation if I could avoid it. It wasn't so much that the knee hurt that much during the course of a normal day, but if I used it excessively, it really did hurt and ached. But the main thing is that, you know, my leg was so bowed and I was short on that limb. And I was really getting more pain from my lower back than I was from the knee, to be honest. And that was probably the turning point when I just constantly having to get therapy on the back, loosening up, mobilise. You know, you've done it, and previous other physios had just worked on that. I got to the point where I thought, no, this is crazy. And then on top of that, I had a relationship with an orthopaedic surgeon, which was, you know, was a really good, solid one. And he explained to me that the new materials, you know, the polypropylene fillers and the metals that they were using were far better than they had in the past. I was always worried that if you got a knee replacement, you'd have to get it done again in 8 to 10 years or so because it would wear out. The new materials, the surgeon was confident that it would last up to 25 years or more. So, you know, I thought, well, that means just one surgery for me, you know.
So when you first had that surgery that removed all the meniscus, what age roughly were you then? About then?
It was about 20 years before I got the surgery. So I got the surgery done in 2018, which is 6 years ago. And I would have been, early 40s when I got it done.
Okay, so early 40s, and then since then, it took how many years roughly before you started to really quite notice? Was it about 10-year period? Probably before you started to notice the symptoms. So then you're early to mid-50s?
Yep.
That's probably when you started to struggle a bit with the knee itself.
Yep. And I could see it. I was losing it. Like I had no quad.
Mm.
It was just a massive jelly. There was nothing there.
Were you rehabbing over this period or strengthening, or what were you doing?
I was probably mainly swimming then. And so my fitness was okay. I wasn't really doing a lot of gym. And what I did do, I tried to stick to stuff that wasn't going to make my knee sore, because at that point I wasn't ready for the surgery. So I would do some exercises like leg extensions and so on to try and help just keep a bit of quad strength. But I couldn't use the quad. I couldn't go up and down a stair. I could go up okay, but I couldn't go down stairs. You couldn't load over the joint. You just wouldn't let you. You know, one, you didn't have the power, and two, it was just too uncomfortable. So it got to that point where it was really starting to annoy me. But as I said, I still thought, well, I'll hold off as long as I can, because that was what you're encouraged to do by your profession, and I guess the medical profession also tries to keep you from having the surgery as long as they can.
After the meniscus surgery, did you go through a period of rehab at all? Do you think that would have helped if you really tried to strengthen that knee from that moment onwards? What's your sort of thoughts?
Well, I rehabbed myself, and because I was sort of relatively pain-free about 10 to 12 days after the surgery, I basically just went back to normal. And, walked around, cycled, swam. I don't remember doing a lot of weights around the knee, but I would have done some. But it was just I was more interested, I guess, in just being able to run. I liked to do that. And the knee recovered really quick. I hadn't lost a lot of quad strength by that stage, so my knee recovered really quickly. It was surgically, it was successful because I had no pain, but obviously I had also no protection.
So day to day, you were saying it wasn't too uncomfortable. Do you remember feeling, again, that there was at least a bit of discomfort each day, or did you feel that it was relatively pain-free until, you decided to go for an extra long walk? I mean, you're on your feet all day at work, so I would have guessed that you would start to feel it towards the end of the day, but... No,
I never experienced that. I had more trouble with my back once the knee started to really wear out. In those early stages, post-op meniscectomy, I had no trouble at all because the smooth cartilage was fine. So I was good for years, and I used it excessively, no doubt, for the type of procedure that I'd had. And as I said before, I didn't the surgeon at the time suggested that the lateral meniscus was badly damaged as well, but it was asymptomatic, so I had no idea that was going to happen, and I certainly hadn't asked for it.
Did that piss you off?
Well, it did a bit. Yeah, did a bit. But what do you do? It's out.
Put it back in.
It's gone. Yeah.
You get back in there and you stick it back in the knee.
Look, his motive was fine. I mean, he saw it under the scope and thought, well, that's just as bad as the medial side, but it's not hurting him for it. So I'll just save him the trouble of having another operation on his knee a few years down the track. I think that's, he wasn't malicious or anything like that, but it did speed up the arthritic process. There's no question, because both sides were without any sort of protection or buffer between the two joints.
Do you know if they surgically now they still take away a lot of people's meniscus?
I think they avoid it as much as they can. I think if you're young enough, they'll repair you. They can stitch up the tear in the meniscus, particularly if they're sort of like a bucket handle, the type which is like a more of a horizontal tearing effect. And they will try and preserve as much of the meniscus as they can if you've got a badly damaged knee, irrespective of your age group. But the main thing, I think, is that there seems to be a genuine shift, if you like, away from just basic knee arthroscopes, because there's not a lot of evidence that I'm aware of that says that it helps. There's no question if you've got a meniscus which is constantly irritating the joint through a flap or major tear or whatever, and you can get a temporary relief from, say, a cortisone injection or something, that it's mainly caused because of a mechanical problem. And they can go in there and they can sort of, move bits and pieces around and shave off the necessary bits, but still retain some of the meniscus, so you get some support still, and that'll probably help. But even then, I don't think there's anything that absolutely is a guarantee. So consequently, a lot of the surgeons are reluctant to do that if they can, try and treat you more conservatively.
Obviously, the two knee surgeries that you've had, they're quite different in what they're doing. One certainly sounds much more drastic than the other. Did you have any major fears, I guess, with either surgery?
No.
Did you have any, I guess, just general concern before going under general anaesthetic or anything like that?
No. I mean, the surgeons that I had my work done by were both known to me, were hugely respected, good people, good men, good communicators. They were, I felt, entirely safe in their hands. And general health was good, so I wasn't worried about anaesthetics or anything like that. I was more concerned about, the length of time it would take me to get back to work more than anything. I don't like being out of work. And the meniscectomy, I think I went back to work the next day.
Yeah, plus, I mean, neither did we. Who's going to buy us Christmas presents, So, leading up to the decision as well, did you have a bit of a process, or do you now recommend certain types of things for people to consider when weighing up the options of surgical versus non-surgical with knees and knee replacements?
You're talking replacements? Or For a knee replacement, you need, I think, someone to look at you a little bit beyond just the joint. Okay, you can get a scan, whether it's an X-ray, MRI, whatever. That'll describe the joint damage quite comfortably. And then you can get an orthopedic surgeon who will say, well, this is what I think you need. Let me know if you want me to go ahead or proceed. But they're only looking right at that very bit. They're looking at the picture, they're looking at that. They're not necessarily taking a massive amount of account of the patient's other factors, which is how they are walking at the time, how they're sleeping, what effect it's had on them in general, their daily living activities, medications that they're on, etc. So I honestly believe that the number of people that I've seen over the years who have either had knee replacements or need them should have an assessment with a physiotherapist who's particularly either interested or experienced in that area, because there's a lot of things that you can look at outside of the actual joint damage to assist the patient in either making a decision one way or the other.
No bias, of course, but physio is pretty good.
Well, I mean, it is sort of pretty bread and butter type stuff for most of us, and you'll get exposed to a bit of it in the public hospital system if you're an orthopaedic physio, and then in the private system, it just depends on the orthopaedic surgeon. Some of them are pro physio for pre and post op knee replacements, and others are ambiguous, if you like.
Is there anything, again, prior to the surgery, is there anything you wish you'd done differently?
Oh, no. Well, have it sooner.
Okay.
In some ways, I think I was lucky because the type of procedure I had or prosthesis I had was a score rotating platform. And the surgeon thought that would suit me the best because I like to play a bit of golf and it allows you to rotate over your knee really quite comfortably. And then there's a component like a little spear that goes down into the medulla of your tibia, down the middle part of your tibia, which he was able to extend and make a little bit longer so it was a bit more solidly planted. So they cement the plate onto the tibia and then they just tap the femoral component in and then put the spacer between. And I think that was relatively new-ish type technology. It's probably been around a couple of years and they'd sort of refined and so on and so forth. So in a lot of ways, I think I was lucky that I was, for the timing, because I got a good replacement joint which allowed me to do the things that I really like to do, which is go and play golf or go for a long trek, etc. Like I did a trek, I don't know, a year or so after the knee replacement in Tasmania, and literally no trouble at all. Felt no pain, no issues. Slipped over in the ice a couple of times, fully flexed it, and initially I was thinking, oh God, what's going to happen there? But got up, full weight bearing, not an issue. Fantastic.
So knee was good that trip. Maybe your warmth wasn't as great.
Oh my God.
As you said before.
I thought I was going to die from that. Oh my goodness. Yeah. I still have horror memories about that.
We'll have to come back to that story as well. But that's handy to know. So, going from the previous treks of Kokoda, Cape to Cape, which ultimately led you to get the surgery itself, to then a year later going on another trek, and the difference between the two, or the quality of the experience that you got to have, I'm sure was pretty drastic.
Oh yeah, it's magnificent. Like you could squat right down and crawl under, snow-laden tree branches and things. You could just do anything on it. I could go up and down, and in particular, like when on Kokoda, I had to have a porter to help me down every mountain because I just couldn't go down straight ways. I had to go down like a crab sideways. In Tassie, none of that, nothing like that. Yeah.
Very handy. Yeah. So you go in, you have the surgery, then you wake up in hospital, and you've got a few days, I believe, that you're hanging around there just to make sure everything's all good. But you're pretty much walking on it day one, I believe, or getting some weight bearing on it.
And look, all orthopedic surgeons do things a little differently. Depending on their preference, they may use different types of prosthesis. The one that I used, as I say, or that the surgeon used, was this, as I say, score rotating platform. It may mean that you take a little longer to recover because it's got a little bit more of a moving part to it. When I went through and saw the physician and got all the information about how it was going to proceed, they told me you're going to have a general anaesthetic, you're going to have a spinal block, and you're going to have an adductor canal block. So in a nutshell, GA, everybody knows that. They put you out. Spinal block is down there to basically block all the pain down to your foot, and it numbs your foot to the point where you can't move your toes. And then the adductor canal block is literally because that femoral nerve and derivatives of goes right into the front of the knee joint. And after the surgery, it's pretty uncomfortable because they are shaving slices of your bone, your femur and your tibia off. So it's a bit like having sort of 8 fractures in your knee all at one hit. And so that's all blocked from pain by these anaesthetics that are just little pumps on the side of the bed. And for the first couple of days or so, all you really feel is an achiness about it, but there's pressure. Initially, it's pressure. And some surgeons will use a tourniquet, others not. So depending on whether or not and how long the tourniquet is on, I guess, depends on how much fluid builds up into the knee joint following the surgery. So I do remember waking up. The first thing I felt was like, wow, there's a big weight on my knee. And it was mainly because the compression bandage put on super duper tight, and it was, there was a lot of fluid pressure down the knee joint, and it was from that. So I couldn't say it was painful. It was just like, wow, pressure and maybe, I guess, an ache. But over the next 2 or 3 days or so, it settles down more and more and more. You do your therapy, you have your medications to keep under pain control. And by the time I left, it was uncomfortable sometimes, but otherwise it wasn't too bad at all. And it just depends a little bit on, you have to be really careful with the way you apply the medications, and the game ready for icing down the unit and keeping compression on the knee. If you do it all according to the rules and regulations and you're regular with your exercises, you will ache and be a little bit sore from time to time, but your rehab will be that much faster because you're stuck to that.
Yeah, so important to sort of stay on top of the medications. And I know a lot of people will throw out painkillers after a short amount of time because it can make them feel a bit icky. But if you can tolerate it, trying to stay on top of them, particularly in the early stages, it gives you a lot more freedom to get some movement back into that knee, or at least for a lot of other surgeries as well. It just allows you to get more out of it in the early stages. Whereas if it's just pure pain, it's pretty hard to get moving on it. With the game ready, so for those who don't know what that is, can you explain a little bit more what?
Okay, so the game ready is a unit that is a sleeve that sort of goes from the top of the thigh through to the ankle joint.
This is not a paid advertisement, by the way.
And it's attached to a box, which is basically on a table next to your bed. The box has got a reservoir, and you put a certain amount of ice and then water to fill up the reservoir so that it's really icy cold. And then you just press the button and all this icy cold water flows through to the cuff, which is on your knee, and compresses you and cools the knee down. So for me, I found that incredibly helpful. The fracture sites where all the replacement joints were placed, they clearly inflame and there's a lot of heat that comes out of the joint, and that contributes to some of the pain and the swelling and the loss of movement and so on. So if you can control that using the ice machine, the ice cuff or the game ready, it makes such a difference to your ability to do your exercises effectively. You can take your medication, and you should always do that, and then if you combine that with the game ready, and I use it countless times every day, it just allowed me to do the work, do the exercise, and then not suffer so much from the aching afterwards. So it kept the discipline right up.
So after, you've left hospital and you've begun the journey of sort of first managing it, is there anything you wish you'd learnt or knew about earlier on?
Well,
I remember you mentioning that you had concerns about, how much you can bend your knee. And that when you found out what they do when they're stapling it back up, it gave you a bit of relief.
Yeah, that's a good point. My knee suture they do the suture layer by layer until they get to the skin, and mine wasn't sutured or stapled; it was actually glued. That's right. And at the time, that was the process that was being used, and I didn't know that, and if I had been told that, I'd forgotten. So when I had the compression bandage on, and then the physio in the hospital is saying, well, I need you to bend your knee past 90. We've got to get it there before you leave here, sort of stuff. I was worried about the sutures popping, So when the surgeon came to see me, I was lucky. He made the time and effort to try and come and see me one lunchtime. And I said, these things are going to hold together, sort of stuff. And that's when he said, what are you talking about? He said, I haven't got any sutures in there. That's all glue. You're fine. You can move it as much as you want. And that was like, oh, light bulb moment, you beauty. Why didn't you tell me that? So, well, I did. And I said, well, okay, I'd forgotten. So, and look, nowadays, if they still use the glue, I'm not sure what it is. But there was that initial concern that by flexing up the knee too much, that something would pop and then there'd be blood everywhere and so on. So unfounded fear, but you do go through all of these little moments, if you like, when you're first coming out of the surgical procedure.
So quite handy to ideally have someone that's sober and not just been under general anaesthetic and whatever other drugs you've been pumped full of, to be nearby to help sort of remember or recall some of that information.
Which, by the way, my view on that is, I mean, the surgeons do a hell of a job doing what they do, and the anaesthetists, magnificent the way that they do that. I think the physios at the hospital should have known that, and should have been able to sort of say to me, well, you can't tear the stitches, you haven't got any, sort of stuff. And the reason they may not have said that is because they may not have known it. And if they didn't know it, then the surgeons should have made sure that all the physios of the wards of these hospitals are aware. That has to be an education process which would take no time at all. But for every surgeon that does this, if they put a little pamphlet or spiel out that the physios can read, because the patient's going to be half, sort of is going to struggle to remember what. But if the physio knows exactly what can and can't be done, I think that would make a big difference to the way they manage the patient. And sometimes a lot of physios are a bit reluctant to push the patient too much because they don't want to hurt them. But if they knew that they can't, that the prosthesis in place isn't going anywhere, even if it's on the first or second day, and I just think there still is a communication lack.
Sure, I mean, and it's one of those things that sounds simple enough to a lot of people that are in it, like surgeons. I guess it's sort of like a common sense. It's such a small detail that you just might not think to pass something like that on until you hear, that a client or a patient had a legitimate concern about it, and you're like, okay, I guess that is helpful information to get across to the person.
And a lot of the physios in these hospitals are young and newly trained, and so they don't have a lot of exposure to this sort of stuff until they get there. So, and often the nursing staff don't know any of this as well. So it's like, unless someone up high tells them, including the people that employ them, then they're not going to know.
So one of the other things is that you leave the hospital, you're starting the rehab process by mostly just managing pain with the medications and the ice machine. Is there anything that you get straight into through that first sort of week to 2 weeks? I guess, what does that, or do you remember what that looked like for you? Are you walking on it? Are you bending it?
Yeah, no, you weight bear on your first day. I had the operation on the morning of the Monday, and I was up after lunch on it. And it's the first time that I could look down at my leg and look at it and think, oh, it's straight.
Yeah, true. After having a bowed leg for such a long time.
Oh my goodness. I'm the same length leg now. And that's one of the surgical tricks. They say, like the surgeon I use does a scan to check your leg length and said, okay, this is the size prosthesis that I need to put on you because this is going to make your legs the same length when we straighten this one up. It's like a miracle. And that, and once again, it's only if you ask and the surgeons can explain to you, one part of your knee when it's bowed is really contracted in terms of all the connective tissue, soft tissue, ligaments and so on. The other part is really stretched right out. When he straightens you up, the part that's all shortened and contracted, which is the medial ligament in my case, has to be allowed for its stretch. It goes from being a really short MCL to a stretched out one. So sometimes the surgeons actually put a few perforations in it just to give it that sort of net-like ability to stretch out a little bit. And that's painful. That part of it there, when you're stretching out an MCL which has been really short for 20 years and all of a sudden not, that's part of the deal as the cause of some of the pain.
So pretty nice to have a fairly straight leg after
I was stoked.
many moons.
Chicks. It's beautiful.
So what did you think when you first stood on it? Were you, again, any concerns that, is this thing going to buckle under me? Or?
No, I didn't feel that at all. I was really confident. I'd seen many of these replacements. I'd worked on other patients who had the replacements, and I knew that once it's in place, it's in place. And with me weight bearing on it, I knew that it would actually set it in place even better. So I wasn't worried about that. You got a lot of lines coming out of you at the time because you're on various medications and so on. The first couple of days, I think I was on antibiotics, and there was a catheter. There was, there's a number of different tubes that are coming out of your system. So you sort of got to worry about all those, and the physio with you is helping you with that.
Just if you point down a little bit, there you go. So, all right, and you've now been at home for a couple of weeks. Did you, and the overall rehab program for yourself, how long do you think it took from going from, leaving the hospital to you feel comfortable to go for a long hike in Tasmania? What was sort of that timeline for you?
It's to feel comfortable and done a decent hike. I mean, that's at least 6 months or so, probably longer. I was back at work after 6 weeks, and that was what I was recommended to do. In terms of getting back on my feet and working as a physio, give it 6 weeks. And that 6 week period, I did everything I could to try and get as much movement and strength back in the joint as possible. It was still a little swollen, particularly the sort of laterally. And I said to the surgeon, asked the surgeon about that, and he said, no one knows what that is, but it's just you get that pocket there. Eventually it does go away and just becomes complete. But you wouldn't contemplate going on a long hike. Well, I wouldn't for a minimum of 6 months or so. And not everyone's even in great shape by then. You've got to remember that the process of getting to the point where you have a knee replacement, you lose so much quad strength. It does take quite a long time for that to come back. You can't get it back in 6 months.
How does your quad strength compare now, left versus right?
Just good as, same.
So 20 years of it slowly degrading and wasting away, and after getting a knee replacement, a couple of years, something like that, to start to regain pretty similar levels of strength.
I was more than comfortable with that hike a year later, no question. My quaddies weren't not as big, but certainly strong enough.
Pretty cool. Doesn't take too, in the scheme of things, a year's not that long when you've had 20 years of slow degradation of the muscles. Was there anything that you found surprising or that was unexpected during your rehab journey?
I think I was so thinking like a physiotherapist about my rehab that I didn't come across anything that surprised me. I reckon every now and then I achieved a range which sort of kind of went, oh gosh, look at that, it's gone another 5 or 10 degrees of flexion or something like that. But otherwise, the hindsight benefit is that I knew how hard I needed to work to get the knee joint to act almost identically to the opposite knee. And that was my physio training that helped enormously with that. And that's why I was quite keen on helping other people post their knee replacements, and hips for that matter, about getting them back in shape, because a lot of times people don't do the work, and they don't get the range of movement that they could achieve. And it's literally because I think they get what they need just to get around, but they don't push it anything beyond that. And the surgeons don't really encourage them to go harder than they need to. So I just sort of felt that I needed to get a really, really good result. And I must admit, when I went and saw the surgeon, whatever time it was later, and he saw my range of movement, he said, well, that's not normal. He said, that's not the average. He said, yours is way above what most people achieve.
Funny what happens when you can put in a bit of work, a few years as a physio and a few years, a little bit of time in rehab.
Yeah, well, I just think it was worth it, because when I went on that trek, I slipped over and went into full flexion and I could handle it. Whereas if you hadn't done that, and you only had 110, 120 degrees of flexion, and suddenly, bang, you don't know what you're going to do to get to that. It's like a manipulation under anaesthetic, except without the anaesthetic.
Did you ever have periods, though, that felt like it was a bit slow or frustrating during the process?
Yeah. Every now and then you'd have a day or two where it swelled up a little bit more than normal and was uncomfortable. And it was, it was annoying or frustrating, but I would just use the ice machine on it more and more and just, keep it as cool as I possibly could. It was 1 or 2 days maybe out of the whole 6 weeks where I didn't do my exercises. Otherwise I persevered, I was pretty diligent, and I had an end goal, I just wanted to be able to get back to work normally. And I took the time out that I needed to take based on recommendations from other people who had gone through the process, not taken it 6 weeks properly, and really rested and ended up with not as good a result.
Okay. So I remember you sort of getting back into. How long did it take for you to get back into work after the surgery?
6 weeks.
6 weeks. You did do the full 6.
Yeah.
And for anyone that currently is living with knee pain, maybe it's been ongoing for quite some time. Maybe they've had it looked at, maybe not. What sort of advice do you tend to give to people that have been experiencing long-standing knee pain?
Yeah, the main advice from my point of view is to look at it more than just at the joint itself, just a lot more holistically. I mean, how are you moving? Are your hips at the right height? Are you shortening that leg? Is your back starting to develop pains or aches or even scoliotic curves? Are you wearing out other major weight-bearing joints like hips and things and so on? Are you losing power or strength? Are you finding that you're actually got a limp first thing in the mornings, or you can't do some of the things like going up and down a hill or a slope on a golf course now? You just have a look at how it's affecting your overall and ask people to observe you and how you move. And if you're really making adjustments because of one particular joint causing you trouble, that's when I reckon you should seek the advice of physio necessarily first, get a bit of advice there about exercise programs and so on, and if necessary, get the necessary advice from an orthopod. Orthopedic surgeons are very, very good at being able to tell you when you need surgery and when you don't as well. So a lot of times you go along to an orthopod thinking, this is, I'll get a knee replacement or a partial or whatever, and they say, no, you'll be fine. I think you'll last another 5 years before we need to do this. They don't just clap their hands together and go, "Oh, you beauty," and then slip you straight into their operating list. They're pretty careful about who they operate on.
One of the final things is, it's been many years now since the operation. Both legs seem to be functioning very well. What do you do to just maintain now knee health post-surgery, now years down the line?
We've been pretty, my darling wife, Susie, and I have been pretty diligent. We exercise regularly. We either go to the gym, go for a bike ride, walk along the beach. I swim a bit with a group of mates. I just keep as active as I can. And that's the plan for the rest of my life, to make sure that I try and retain the strength around the joints, the major weight-bearing joints, as much as I can. I haven't had anywhere near the back trouble that I used to have. It's so much better. It's incredible. Every now and then it tightens up a little bit, but when I play golf or something, but otherwise I just get my son to give me a bit of therapy, and all of a sudden I'm fine again. So, but the big change for me is that not only is the knee more functional and stronger and so on and so forth, but the other parts of the body that were under strain have really been released, if you like, from that strain.
Cool. Well, thanks for giving us a little rundown on the journey of the knee from my father, Ian Lowther, physio, podiatrist, etc. No, I think that was really good. So hopefully anyone out there that is having some knee issues will just consider a couple options and things that you've talked about so far. So well done. Thanks for that.
You're welcome, mate.
Cheers, everyone.
Bye-bye.